Thank you everyone for coming to our session today on hoof health management with Dr. Gerard Cramer. Uh, it's a great honor to welcome him as today's speaker. Gerard is a highly respected professor at the University of Minnesota with a focus on dairy cattle lameness, hoof health, and management. Originally from Canada and the Netherlands, he earned both a doctor in veterinary medicine and doctor of veterinary science from the University of Guelph. From his beginnings of running a dairy farm and then a hoof health specific veterinary practice, Dr. Cramer has dedicated his career to improving hoof health and reducing lameness in dairy cattle through innovative research and practical on farm solutions. He has authored numerous research articles and extension materials aimed at educating farmers on best practices for preventing and managing lameness. His work bridges the gap between scientific research and everyday management, making his insights invaluable to producers. We are thrilled to have Dr. Cramer with us today, and we look forward to learning from his expertise in hoof health and lameness management strategies. Welcome, Dr. Gerard Cramer.
Thank you, Cora, for the introduction, and I will share my
All
screen
right.
to get us started. So my focus for today is Cora asked me to talk about keeping heifer hooves healthy, and I'm going to try to tell you that if we prevent them from getting DD by using a good foot bath, do anything we can do to avoid corkscrews on heifers, and trim animals appropriately when if needed, you can do a very good job keeping your heifers healthy, and you can start them off on the right foot and prevent them from getting coming into your lactation or first lactation with problems and set them up basically for a lifetime without lameness. So just so everybody's aware, this is my conflict of interest statement. As you can see, there's a lot of logos on this page. My philosophy is I like to try make everybody a little mad at me at times. That way I know I'm kind of doing my job. If I mention a product that's on this slide, it's not because they're giving me money. As you can see, there's competing companies on there at times. So it's more just to be for you to be aware for people that have supported me, some of the research I do, and I also want to thank some of the hoof trimmers and veterinarians I've worked with, and students and collaborators, and especially the farms that have allowed me to try some of my harebrained ideas and learn from them and their staff. So let's get into this. We're going to talk about digital dermatitis. So we're going to talk about warts and what we can do to prevent that in heifers, corkscrews, and hoof trimming. We'll kind of go through them in order. And hopefully by the end, you'll have a sense of how relatively straightforward it is to prevent problems in heifers and start them off on the right foot. It's not necessarily easy, but there is some key concepts we can take home. So digital dermatitis. So I argue this for lactation cows, but especially for heifers too. I'm going to argue of the problems we're going to deal with, it's the easiest to control. Um, so we have to remember with digital dermatitis that there's different stages of disease, right? So ideally, all your heifers come into your herd after calving and they're completely clean, so in the M0 stage. Hopefully, none of them come in with this active, acute, painful stage or this very chronic stage, right? This M4 stage is the chronic stage. So the goal is to have as many animals as possible with healthy feet. And if necessary, they have like some chronicity to it. They're not active lesions. We don't want animals that come in with this active lesion or with very chronic lesion. So that's something to remember because we're going to discuss kind of the process to it. This kind of intermediate stage, the M1 stage, that's kind of the stage before they become this M2 stage. So that's kind of early affected stages that we can deal with. Okay, so why is that important? This was a study done in Wisconsin by Arturo Gomez, who's now working for Zimpro. And what they did, they followed over 500 heifers pre-calving, and they followed them. And then they said, okay, what happens to you in your next lactation based on how many cases of DD you had before calving, right? So if we look at the animals here, so this animal's right here, these were animals that did not have any DD cases as a heifer. And then this graph represents what percentage of those did not have any DD lesions in the next lactation. So as you can see, if you did not have a DD case before calving, over 80% of them did not go on to have a lesion in their next lactation, right? So roughly 85% of them, or 85% of them did not have a lesion, and 15% went on to have a lesion, with a small percentage of them going on to have multiple lesions. Compare that to animals that had one case of DD as a heifer, and this was pretty aggressive finding, right? So Dr. Gomez lived in this pen basically for his research project and followed these animals around. So these are very early cases that he found, and then they were treated. So if they had one case of DD and they were treated, about 50% of them went on to not have a lesion, but the other 50% went on to have at least one lesion and sometimes multiple lesions. If you had more than one lesion in before calving, the majority of them cows went on to have lesions again in first lactation, right? So the take-home message from this is that we should consider DD a lifelong infection, right? So if heifers have a case of digital dermatitis, they're more than likely going to have a case for the rest of their life, right? So half of them in the first lactation might not get a lesion, but that's these lesions are pretty early. So unless we can find these lesions, I'm not convinced this is true if we were under typical farm conditions where we might not be as aggressive as finding these lesions. So we need to ensure that heifers calve without having any DD on their feet. So that's kind of one take-home message. That's why I think it's important to focus on DD. So how do we do that, right? So how do we prevent DD from happening, right? So I would argue most farms and across the world have DD in their lactating herd, so we have to keep it out of our heifer facilities or manage it in our heifer facilities. One key step with that is hygiene. So the cleaner and drier the floor is, the cleaner and drier the cow's feet or heifer's feet are going to be. So if we can manage that, that's kind of the starting point, right? So how often do we scrape? I'm not a big fan of alley scrapers, but because they kind of coat the feet. But if we scrape more frequently, at least twice a day, or if possible, I know in a heifer facility that's harder to do, but at least once a day, every other day, we seem to see more DD in heifer. So that's kind of one starting point. Then the next step is, of course, using a foot bath, right? And that becomes difficult to do in heifers facilities. And we need to think about what options exist or what's happening, right? So here you can see kind of two options that are happening. We have the typical portical plastic foot bath with the barrel of formaldehyde right beside it, or another version kind of sitting right here, right? So in this scenario, when I see foot baths like this, I automatically expect to see higher DD prevalence or incidence in heifers, right? Because this takes extra labor to get it set up. There's no easy access to get water to it, that type of thing, right? So when we're thinking about foot bathing, what I like to think about is have some options or figure out a way we can do it to make it easier on the staff and to make it an easier task to get done. One example of that is to use something portable, right? So this is actually a nice long foot bath. So this foot bath original here, those are about 6 feet. This is actually a 12-foot bath. It's got sides on it, so the splash and the water stays in the bath and the heifers can't sidestep it. But it also is very easily movable, right? So this one manually somebody has to carry over and move over. Here we just have to fill it up with water. There's a barrel right here, attach it to the skid steer and move it to the location where we need to do. It's got some hooks that put gates on it, so it makes it an easier job to get accomplished, right? And then, of course, the ultimate, if you have the facilities, if we have something permanent, there's a water line right here. This is permanently set up. This is another 12-foot bath. This is in one of the transfer lanes. So we can run the heifers through, move them out of the pen, move them through and back into the pen. And we can do multiple pens relatively easily, right? So this is, to me, a key component when we think about managing DD in heifers. We need to figure out a way to get the foot bathing done, right? And then people ask me, well, when do I start foot bathing? And then my response to that is, I want you to start foot bathing the pen before you see active DD cases in heifers, right? So if you're seeing DDs or you're seeing active painful lesions in your pregnant heifers, you should be foot bathing your breeding pen. If you're seeing it in your breeding pen, you should be foot bathing your pre-breeding pen, right? Because we're trying to prevent this exposure. Because by the time you see it, it's been developing for probably around 100 days. Let's say 60 to 100 days it's been developing. And so that's why you want to be before the pen that you're actually actively seeing cases, right? And then the biggest thing we can do, because hygiene is the harder to control. Yes, there's things we can do with scraping, but ultimately it comes down to figuring out a way to run a foot bath in your facility. Because if you don't run a foot bath, then we're down to things like spraying or just treating the active cases and not necessarily preventing it. Okay. Just some kind of measurements for foot bath design. These are very similar to the adult heifer, adult cow foot bath design. So we want something with higher sides, so the splash comes in relatively narrow, so you can have a longer foot bath. If you have a lot of heifers that you're running through, you can go wider, but you still want the sides so multiple animals can pass. But these are some very commonly recommended foot bath dimensions. Right. So then the next question is, how often should we do it? I know I get accused of being or people say this is a very academic answer, but it's to I think we have to become more nuanced in things we say, right? So you can easily say, okay, you need to do it twice a week or three times a week. To me, it truly depends. It depends on what data you have and what your animals are showing you. I would argue most facilities need to do it at least once a week in the heifer facility, but it truly depends, right? To me, digital dermatitis is something where you choose how many cases you have, right? So to me, it's a dial. The foot bath is the dial. And if you want less cases, you turn the dial, and the dial is the foot bath, right? So if you are relatively happy with your control, you have very little cases, then you could either consider reducing it, or if you're risk averse, you can say, okay, I'm happy with where I'm at. I'm not going to mess with it, and I'm going to stay with it. Okay. And to me, it's as much as necessary, which kind of gets a dial and reduce it based on data, right? And this data could be from if you're doing your heifer trimmings or you're looking at how many cases am I seeing each month. But just an example of that, this is a data from a 600 cow herd where we just pulled out a dairy comp, the number of cases that happened in the last year. And this is just specific to digital dermatitis. And it's split by lactation group, right? So there's roughly, let's say, 200 first lactation animals in this herd. And they had 5 cases of DD in first lactation animals, and 3 of those were right after calving, right? So that tells us that we have animals coming in that are painful with DD. So either that means with 3 cases out of, let's say, 200, that's a relatively low number. That's 1%. We can decide, okay, is that too many? Are we happy with that? Are we not happy with that? In this scenario, it looks like once we get into the main herd, DD is relatively under control, right? But I'm a little concerned that we're seeing these active cases here. So I would want to do a bit more investigation. But in this scenario, if we're having, let's say, 200 cows, so just over 1% of heifers coming in with DD, that's, I would argue, pretty good, right? What else can we do? So whatever program they're doing in this scenario might be working. However, if this number is much higher, let's say this number was, let's say 20, 30% of animals coming in, then we're dealing over 10%, then we might want to consider changing the program that we have for heifers, right? So this is what I refer to when we have data. So if your trimmer's trimming heifers pre-calving, um, look at the data and kind of make decisions based on that, right? There are some feed additives on the market. Most of them have a little bit of data on it, and most of them is kind of right. It works kind of maybe type thing. So ideally, we'd have more data on them, but something maybe this is something you try in your herd, see if you notice a difference. But the research data on most of these products is there's some data behind them, but not overly convincing all the time, or in certain scenarios it might work, in other scenarios it might not. So when it comes to feed additives such as yeast or some trace minerals, there's a place for them in certain herds, but they're not going to be as effective in all herds. And without a foot bath program, they're a secondary tool that we can use in certain scenarios. I have some clients that I work with that are swear by the product, and others that have tried it and haven't really noticed it. Okay, so let's move on to corkscrews, right? So we got digital dermatitis kind of under control. We have a sense. Basically, we run a foot bath. Let's move on to corkscrews, right? So corkscrews, when I talk about corkscrews, if you're lucky enough to not have seen it, what we're talking about is basically this rotation of one of the hooves on a cow's foot. Traditionally, we used to think of it on the outside hoof, so the lateral hoof on the back or the medial on the front. But we're actually seeing a lot more something called people call a reverse corkscrew, where this rotation is happening on the medial side of it, right? So this one here is an example of it on the lateral, but we're also seeing it on the medial hoof, which makes it a bit more complicated to deal with. Okay, when we get to corkscrews, what we have to realize that a lot of things that I'm going to tell you are based on opinion. There's very little science behind or even knowledge about DD or about corkscrews at this point in time. There's a lot of theories and people have done some work to try and figure things out. But ultimately, when it gets to how do we prevent it, what's causing it, what things work, what don't work, there's a lot of opinion and not a lot of data behind it at this point in time. Okay, so what is it? How can we differentiate it? Because this is one point that I think we need to get a little bit more precise about, because a lot of people think if as long as there's any type of curl on the cow's foot, that's a corkscrew, but there's actually something we can look at. So this is an example of a heifer with a relatively mild corkscrew starting, right? So what we're looking at is what this rotation is happening right here. This is how you can tell at the front, right? So here we can see more normal, where there's a bit of curvature at the toes, which is more considered normal. But when the curvature starts at the coronary band and curves like that, that would be considered a corkscrew. So let's look at that into a bit more detail. Right, so here we have two animals, one which is relatively normal. So we're going to draw a line right here from the coronary band right to the toe, right? And that's relatively straight and there's no curvature happening. Same thing on this foot here, right? There's very little curvature happening. Then if we draw the other one, what we're looking here is the space, right? So in this one here, yes, there's a little curvature at the toe, but not if we look here, right? So this is a big curvature happening. There's actually a Leghorn, and there's not that same Leghorn on this side, right? So this would be considered a normal non-corkscrew, even though there's some curvature happening, but the curvature is happening just at the toe, not starting all the way up the coronary band, right? So in this corkscrew here, the whole foot is turned, which is where the name corkscrew comes. So that's one key differentiation point I think we need to realize, right? So even on the normal, we can see there's a little bit of curvature to it, but there's not that same ledge. The kind of guideline I use, if I can put my finger or my thumb on that ledge, which works out to about 20 millimeters or just over 3/4 inch, that typically indicates that it's a corkscrew. Okay, so what does that actually mean, right? So the problem with that becomes is that this corkscrew changes the weight bearing of the feet, and we actually get to see more thin soles on the non-weight bearing hoof at this case, because the corkscrew becomes the weight bearing. So on the front, that means the thin or becomes lateral, or the lateral becomes thin, and on the back means the lateral also becomes thin, right? And this curvature changes how the cow walks. So if we, over time, especially as these animals get older and we manage them, these animals start to kind of walk kind of like that typical sign that we're seeing on this video. And we can't fix that, right? We can't, we're going to get into a little bit of the anatomy so to help you understand what's causing these corkscrews. But this is a permanent change, right? So all we can do once your heifer has this, all we can do is the animal, manage the animal from then on forward with the hope that she doesn't end up looking like this cow at this point in time, right? Because those of you that have cows like this, you know that they walk really awkward. Um, there's obviously amount of pain that's happening when they're walking because you can sometimes see them, some of them will stop and shake their feet because of the thin soles. So there's some discomfort that we're seeing when they walk that. This is probably more arthritis related, but it starts off in most of these in first lactation or as heifers that they have corkscrews. Okay. What we need to realize is that this is not a new disease, right? So what we consider, what us hoof trimmers consider the Bible in foot trimming. This was written in 1985 by a Dutch veterinarian, Dr. Toussaint Raven. But he described and has pictures of it, so hand-drawn pictures of what we consider a corkscrew. And we can see this curvature, right? This is pretty much exactly what I showed you before. This was his direct quote. So it could be related to the fact that when they are feeding, the animals lean against the manger and their legs wide apart to reach the fodder. This is pretty much exactly what we still think and what's causing this, right? There's more nuance to it. But what I want you to think about is this is not a new thing that we're seeing, right? We're seeing more of it in certain scenarios, and we'll discuss what those scenarios are. But it's not like there's a new disease that's happening. This has been described before. It's been around at least since 1985, which is almost 40 years ago. Okay, how common is this? This is just an example of a picture I took at one of my research farms in the parlor. And let's say we have 1, 2, 3, 4, 5 animals here. And we have 1, 2, 3 of them with corkscrews, right? So over half, there's just circles of some normal. So we can quickly get a sense of what's happening. But that's one herd, one specific herd. But in some herds that I've worked with, it's almost non-existent. In other herds, have worked with a herd where over 60% of first lactation animals have corkscrews, right? So then in the future, those cows are not going to do well. And of course, we're going to have increased culling rates all those other things. So what about some data? There is actually some data on how common it is. A recently concluded study in Wisconsin on 43 herds. They found 16% of heifers had corkscrews and about 33% of cows. So that indicates there's something happening or some accumulation in cows. And if we look at just the heifers, 30% of that happened in breeding age, 23% of the pre-fresh heifers had it, and 16% of the pregnant heifers had it. Right. So as we can see, there's kind of a growth. If we see it in pre-breeding, then more of them get it in pregnant, and 23% in pre-fresh. So there's probably like an cumulative effect of it. And it takes time to develop and kind of show up. Okay. This is an example of some data from a herd. This is a 4,000 cow herd or over 4,000 cow herd. And if we just look at corkscrews, this is probably the main lesion we're dealing with. The next one is thin soles, which is probably directly related to the corkscrews, right? So this is a herd that is really struggling with corkscrews. And if we look at it, 50 of the animals that we're milking, so we're milking just over 4,400 cows, 2,500 of them, or 2,500 cases of DD have been diagnosed in this dairy. This was from 2021 data. So relatively big problem in this dairy. And talking to the trimmer, they struggle with this, and then he struggles with, of course, the thin soles, which are basically directly correlated with each other. Okay. And then if we split that data up, most of the problem seems to be in first lactation animals that's happening, right? So this is just a raw count, but a lot of these cases are happening in first lactation. So probably close to half are happening in first lactation. So some of these animals get culled and don't survive. And then some second and third lactation animals still have it, and we can manage them with. Okay. So I've kind of shown you the data that in some herds, this is a big problem, but what is causing it? What do we know about it from that aspect? So how common I told you it was kind of 13% in breeding heifers. Then if we start looking at it, what are the prevalences at different bedding services? So if we go to recycled sand facilities, so a herd that raises their heifers on recycled sand, 45% of those heifers have corkscrews. If we use fresh sand, 22% of them have it. And this is where it gets interesting. If you use some type of organic bedding, whether we recycle manure solids, straw, shavings, that type of thing, only 6% of heifers had it. And if you use a mattress or didn't use any bedding or any surface, only 4% of heifers have it. So this is interesting, right? So this is just, so there's a saying, right? Correlation does not equal causation, but there's definitely something interesting happening here. And when we've changed some of these things, we can take a recycled sand herd with lots of heifers with problems. And if we start bedding them with organic material, so we switch them from deep bedded sand to organic material, deep bedded organic material, we can reduce the number of heifers that get corkscrew, right? So there's definitely something happening, and I would argue this is partly causative, and we'll kind of explain what could be happening here. Right, just to understand a little bit more, if we look at the anatomy, what's happening inside the foot, because we need to realize this is a chronic disease. We cannot change once this rotation's happened. We cannot fix it by whatever we do trimming wise. We can only manage it. Right, so here we have a picture of a corkscrew. We can see the rotation. And what I then did is I took my bandsaw and cut it open. So we have some pieces and we can see actually what's happening inside the bone. Right, so this is the 2 feet or the 1 foot that I've cut open. And here we can see the differences. So this bone here we call P3, and this is kind of normal position of it. It's not quite flat, it's at a bit of a rotation. But here we can see that this P3 here, it's a different size. It's much smaller. So what happens on these corkscrews, actually, they become thin and pointed, but they also rotate, right? So what happens is this bone is turned like this in this direction, which changes how much horn is actually underneath of it. So when we're trimming these, we have to be careful that we don't get them thin. And then they're also, because of that, we have this rotation of the horn here. So this is why these feet look like they're turned. And then there's a lot of horn growth happening here, which I argue is due to stability, for the need for stability. So if you imagine if you have this bone that's positioned like this and we're walking, there's a tendency to want to turn over this way. So this is horn that's produced to create some stability in the foot. The other thing to realize when we look at this from an anatomy perspective, so this is a normal bone, so P3, and then this is something called the navicular, and this is P2 that's sitting there. So this is the normal side. This is a corkscrew side. This is similar to where I've cut off the pieces because I wanted to show something. And then there's some bugs that can take away all the materials around it. But where you can see that, yes, it's narrower over here, but then it's actually wider and there's extra bone growth sitting on top of here. So if we look at a little closer here, we have more bone growth here, but also higher up on here, right? So this part here does not have this protrusion sticking out here, and there's more protrusions happening here. And that's basically where some of the tendons and ligaments attach to these bones. Right, and we can also see some of this rotation. So this bone is changed here, and it's also changed up in here. It's actually rotated higher up. So the thing to remember is these P3, those are permanent bony changes that happen, but it's not just this bone at the bottom, P3, that's affected. It also changes P2, and even higher up, we see change. Okay, that still hasn't got us to the why. It's gotten us to, okay, what's happening inside the foot? But that's there. So what's causing it, right? So we kind of pretty clear that's related to heifer housing or heifer raising and how we do it. Um, and I argue it's due to competition for resources, right? So yes, we see it more in recycled sand herds, but we also have some recycled sand herds that don't have it. Or we see it in herds without recycled sand that have it, right? So there's some herds. I have some friends and colleagues in, for example, Manitoba or in Canada, and we have some herds with a higher than expected level of corkscrews. And it's due in that scenario, I think, to the competition for resource. So if your heifer pen looks like this, and imagine you're a heifer here trying to fight to get to the feed bank, or we limit feed our heifers, or we restrict access to the feed, that type of thing, or we're overcrowded. Now these animals have to fight for the resources. And when they fight and they have lots of traction, they can basically put extra stress on their bones as they're leaning forward, kind of butting heads, trying to get into the way. And this happens on both front and back feet as they're pushing each other forward. Okay, but this can also start young. So I have a colleague, one of my students actually in California, and she emailed like, what age can we start seeing corkscrews? Because she made an observation that she was seeing the start of corkscrews out of animals coming out of wooden hutches. And her client actually took animals out of these wooden hutches and put them in plastic hutches. And she made an observation that as soon as they took them out of these hutches, the heifers that were raised out of wooden hutches and placed in these hutches, their feet actually look better. So let's look at that in a little bit more detail. So this is an example of an animal, a calf, raised in a wooden slatted hutch. And see how we can start to see the rotation there. And then this is an example of an animal, and I apologize for the bad pictures. These are the ones she sent me with kind of those straight lines and not having the corkscrews. If we look at these hutches, see, we can see these slats that are sitting right here. So when these animals are reaching for their milk or are thirsty and the milk's coming, what we suspect is happening is they can really put a lot of pressure on their feet and kind of get the grip they need because of these the spacings in the wooden slots. Whereas that's not necessarily the same thing is true here, that when they do that here, they're sinking into the soil or into their bedding, and we don't have the same pressures being exerted on it. There's not the same leverage they can get. Okay, so why does that happen? So just a little bit of anatomy and bone growth. If we think about how bone develops, there's typically something called bone growth plates. So this is a growth plate here. And these growth plates, especially as animals are growing fast, if we put excessive or undue pressure on these growth plates, it can change it. So if we imagine an animal that's pushing itself forward, for example, and is pulling on this bone right here, we can change the future growth or the growth that's going to happen based on that. So my theory is that because we're putting lots of pressure on these bones during a time of rapid development, we're changing the growth plate, and actually the angle of that bone changes because of the pressure that's being put on, because we're doing it right at the right time. And that right time probably, so obviously we can see it in very young animals, but I think the other key risk period is kind of right around puberty, kind of breeding age heifers as that happens. So this is just a close-up of that's what's happening. But I think as we're pulling on this bone or putting pressure on this bone, we're pulling, let's say, more pressure here. So then the bone compensates in growing more in that direction. This is all a complete theory. But if you look at some of the bones, there has to be a reason, and the bones inside the foot are still considered long bones and have some sort of growth plates. Okay, so this is just an example of that. If you imagine we're putting pressure down, we're trying to force each other on this side, and that means we're getting more pull here. So more pull results in more bone growth, and then the pressure down here and the pull kind of results in the rotation of that P3 inside the hoof capsule, because the hoof capsule itself, it's not necessarily all that attached in there. So there's actually only a laminate about the bottom third, which is what you can kind of see here. So if you have that pulling and pushing kind of happening at the right time, and the attachment and the laxity in those ligaments, this bone rotates and changes growth pattern or changes size because of that. Okay, how do we prevent it? Well, easiest thing we can do is reduce competition, right? So push up, feed more frequently, feed more frequently. If we can reduce competition, I'm gonna balance it with traction, right? Because if we go back to this, and based on some experiences we've had, if we take out one of the variables being the traction, and replace it with something organic, we reduce the number of corkscrews we get, right? We might not necessarily we still have competition for resources, but if we now take away the traction, right? So we put these heifers on sand because we thought this is great for cows. It's going to be great for heifers. And it probably is from a comfort perspective, but from a traction perspective, because they're developing and growing, we're then putting undue pressure, allowing them to really get a good grip when they're fighting. And that extra grip is probably changing how things are happening, right? So without the traction, they might slip a little, which in this scenario is actually a good thing. So we're trying to balance, right? Because too much slipping results in other issues. Um, so that's kind of the trade-off we're making. But the biggest thing we can do is make so there's a saying among us foot fetish people that friends don't let friends build heifer facilities with sand bedding, right? And then it gets to grooving. Well, what kind of grooving can we use, right? We want something with some traction, but too much traction is a problematic, right? So things like Mooney grooving or these deep white groovings could be acceptable depending on the surface we're using. Some people have gone to, they want to keep with recycled sand, and they've started putting rubber at the feed bunk. I'm not convinced that's going to work, but we'll see. That data still, or that work is still in progress. But there are things people are trying to kind of, instead of having a lot of pressure putting down with the rubber, hopefully we'll have more sinking and not quite the same pressure as we would on concrete with good grooving. Yeah. What do we do for treatment once these animals have it, right? So what can we do about it? To me, the goal of treatment is, so this is an example, these are the same feet. So, right, we have this corkscrew here. The problem with all this excessive growth right here is it puts undue pressure on this location, and we can get ulcers developing or sole ulcers developing right. So the goal for treatment is to prevent future damage. And the future damage is getting sole ulcers happening in there or thin soles happening here, right? So we need to manage these animals. Um, and the goal would be to prevent future damage and improve their gait if possible, right? So some of these animals walk awkwardly because having this ledge right here is imagine having a stone inside your foot. That's kind of sometimes what's happening here. So we have excessive pressure happening right here. And that results in pain to the animal. This excessive growth on this hoof here can also make this foot or this hoof non-functional, kind of so it kind of just hangs there and kind of drags on the ground and doesn't necessarily function like it should, which is why it sometimes results in thin sole. Right. So if we take this treatment here, so what I think the appropriate treatment is to remove as much of this horn as possible. So when we're done trimming here, this is quite thin and soft because what we're trying to do is we're trying to gain as much time as we can without pressure here. I think, or I believe that we need to keep this ledge of horn right here because that's there for stability. If you imagine P3 now is very thin and narrow, we want that stability because the cow is going to rotate this way. And if we keep this ledge here, although it looks real ugly, it's actually more functional to deal with. Okay. This is an example of what that looks like after, I think this is 2 months after we trimmed this foot. So we can still see a lot of this modeling is what we call it. That's still there. This ledge of horn that we kept there for stability is still there. And we have a relatively balanced looking foot as opposed to if we let this animal go for another, let's say 4 months, there would be a ledge of horn here again. All right. So this is another key part of dealing with these animals need to go on a high maintenance trim schedule, right? So I would argue we need to trim, depending on your environment, every 3 to 4 months, right? Which is a lot of management of trying to have these animals. But I think when we do this, we kind of prevent that waddling that we saw on those older cows from before. Certain percentage of these cows are going to go on to become those waddlers. And then I think we need to make culling decisions about these animals. Okay, moving on to hoof trimming. Right? So if we think about hoof trimming or heifers, right? So we need to think about what's the goal of trimming. The goal, in my mind, for trimming, whether heifer or lactation animals, is to treat lameness or to prevent lameness. So if you have a great heifer facility, you're likely not trimming cows to treat lameness. And then the question is, okay, if we trim them, can we prevent lameness? Right? And the preventing lameness then becomes the preventing lameness in first lactation animals. And the data on that is relatively sparse. So when I did my Doctor of Veterinary Science, so kind of like my PhD degree, I have some data to show that in Ontario, when we trimmed heifers pre-calving, we actually ended up having less problems in first lactation. Because I'm old, that was over 20 years ago. And actually, there's not a lot of other data out there that suggests that trimming heifers is beneficial. There's actually some data coming out that even questions if trimming first lactation animals is beneficial if we don't have lameness, right? The key part of that is if we don't have lameness. So to kind of understand why or when you should trim your heifers, we kind of need to understand what lesions we're dealing with, right? So trimming should be thought of as something that if we're doing it for prevention, we're trying to prevent sole ulcers and white line disease. And we need to understand what causes these lesions. Right. So when we think about hoof-form lesions, so ulcers and white line, what causes them? It's kind of a combination of what we call the digital cushion, or things that happen to the digital cushion, which is a thin, fat-like pad that acts kind of as a shock dissipator. It's not necessarily shock absorption. It kind of dissipates and spreads the weight. Standing time, thin animals, and things that happen around calving. Right. So what happens if we have too much standing time, excessive horn growth, so think back to the corkscrews, and around calving, this bone, so P3 that's kind of hanging in this hoof capsule, it puts pressure on the corium. So the corium being the pressure that's kind of, so we have these green tissues here, but this red tissue that grows the horn is underneath it. When there's pressure, excessive pressure on that tissue, that results in lesions over time, right? So a little bit of pressure results in hemorrhage sticking out. A lot of pressure results in that tissue stopping to produce horn. What does that look like? Right, so we have excessive pressure. There's another pathway here for lame animals. We're going to ignore that for today's talk. But we have this movement of P3, right? And right underneath there, we have pressure, whether that either be on the outside to create white lines or underneath this bone right here, the flexor tuberosity to indicate sole ulcers. What happens when that occurs, when that pressure happens? We get damage to the tissue, right? So this is part of the corium. So this is damaged corium. And we can see what that results in. And here we can see that what we actually see inside the foot. So this is something we call ulcer. An ulcer should be thought of as kind of, or sorry, this is hemorrhage, which should be thought of as an early sole ulcer, right? But when we see this, what we need to think about is what's happening inside the foot. So there's damage already happening inside the foot. And when I used to trim full time, in certain scenarios, you trim a first lactation animal and the whole foot would kind of have these speckled red dots all throughout the foot. And that just means that there's been a lot of pressure over that whole foot in that scenario, right? And those are the scenarios we're trying to avoid because as soon as we have that pressure, what happens is inflammation happens. So once that inflammation happens, that results in basically more bone growth because the tissue that's separating the horn from the bone is basically about a 1/4 inch thick. So if we have inflammation in that tissue, we also have inflammation on the bone. Inflammation on the bone results in more bone growth, and we kind of end up with a cycle, right? So we have pressure on this tissue. It creates an inflammatory response. The inflammatory response creates more bony growth, and we kind of get this vicious cycle, and eventually end up with cows with ulcers and white line. And that's what we're trying to avoid. Okay. The reason we want to avoid that is once we have that inflammation, we kind of end up with these extra bony growth, right? So imagine once again the rock that is in your shoe. If you're continuously walking with a rock in your shoe as a cow, then you're continuously going to be lame and have this history. So this is some imaging from cows with no lameness history and with lameness history. So this is normal P3, nice and smooth. And this is one with lameness history with lots of extra bony growth. So the point we're trying to make is we want to prevent these type of bones, right? So if we have heifers that have, for example, long feet that are going to put more pressure on it, if they calve, because now we're adding another variable to it, calving is also an inflammatory process. We might set them up to start down this cascade of developing extra bone growth and becoming an animal that becomes lame. Okay. I'm a believer in strategic trimming for lactating cows, right? So I think there's four kind of groups of cows in your herd. There's the healthy cows that need to be trimmed because they may have long feet, but they never go lame. There's the lame cows. There's the cows that were recently lame and need a recheck, and there's the chronic cows. And I would argue these cows need to be trimmed differently, right? So our healthy cows, it might be fine to trim them once a year. These lame cows need to be trimmed repeatedly. These recheck cows need to be trimmed whenever the recheck is due, right? So in my mind, that's typically around 4 weeks. And these chronic cows, they become your high maintenance trim, right? So they might be trimmed 3 or 4 times lactation. But these healthy cows probably don't need to be trimmed 3 or 4 times lactation, right? Sometimes two is enough for these, sometimes one's enough for these, right? And we need to structure our trimming program appropriately for these cows. So what does that look like in heifers? Right? I think instead of thinking about most heifers, hopefully are healthy. So then what we're dealing with is what my criteria is, what do your heifer feet look like before, right? So we can look at this foot here. There's actually two things happening, all right? So if we're on sand bedding and we're on dry lots and our feet look relatively short and don't have any problems, so that means we don't have something that looks like this. There's actually some digital dermatitis on it. But if both feet look like this and they're relatively short already, I would be very careful trimming these animals, right? So, for example, there's some clients I work with that bring heifers back from Kansas, Colorado, or Texas, and most feet look like this. And then we put them on recycled sand or on concrete. So the last thing I want to do to those animals is take any horn off because they have very little horn to start with, and they're probably going to lose some of it as they're walking now on concrete 24/7. Right. So in this scenario, most of the time, I'm not sure there's a benefit to trimming these animals if they aren't lame, right? Okay. Then we have the scenario we described before. So what about these herds with corkscrews, right? If you have corkscrews, a lot of corkscrews on your heifers, competition and traction, then I think we need to trim these, all right? Or we can actually even add if you had digital dermatitis. These animals, heifers probably need to be trimmed pre-calving. Then the next group, right? So if you're raising your heifers on pasture, or on a pack, or a mattress, and you pre-calving, you have feet that are really long, right? Those heifers probably also need to be trimmed at least once before calving, right? Because that extra horn growth changes and puts more pressure towards the back of the foot, setting these animals up for potentially more ulcers and white lines. Right. So if we kind of think back to it, so strategic trimming in heifers is like, what do the feet look like before? I don't want to make a general recommendation that every heifer in the US needs to be trimmed pre-calving. I think it totally depends on the environment that they're housed in and raised in and how much of an issue we have, right? So if they're short already, why are we touching these animals? If they have corkscrews or are long, yes, then definitely they need to be trimmed. Okay. Hopefully I've given you a sense of what we can do to keep heifers healthy. I think the keys are make sure they don't get DD by running a good foot bath program, even in your heifers. Take the labor, make it work. You can do it relatively easily, in quotation marks, by running them through the foot bath once a week. And you can even do it, okay, as you're doing them, run them through it once, turn them around and run them through again. So you're getting double the contact time for the labor you're investing in setting everything up. Do anything you can do to avoid corkscrews. Corkscrews are really difficult to deal with once we have them, so prevention should be the goal. And then trim if needed. And not, I would argue, most animals probably don't, heifers don't need to be trimmed, especially the way as the industry is getting larger. We're housing heifers on larger areas, so they're walking further, that type of thing. With that, I'm happy to take questions, Cora.
Wonderful. Thank you so much. Um, if anybody does have any questions, feel free to throw those into the Q&A section. And while we wait for those, Dr. Kramer, I really appreciate what you said with a number of things that you brought up today, and something that stuck out to me when you mentioned the feed additive side of things. I um, always like to encourage people of, hey, consider that name feed additive and think in addition to. So it's in addition to your management, in addition to all of these other pieces going on. It's never the silver bullet for anything. It might
Exactly.
actually work, it might not work, but so much, especially when we're dealing with nutrition, it's the joining of all the pieces together to get that puzzle to look as beautiful as it does. So,
Yes,
yeah.
definitely. Right. And I've done some work with Zimpro, which is one of the companies that sells the feed additives that claim like
Hmm.
there's something I have the DD formula. And they're right up front about it. They say, yes, this our product, we think it works, but it's not going to work if you don't foot bath your heifers. Right.
Right.
It's an additional tool you can use, right? So if you let's say you have 5 cases per 100, even with your foot bathing, it might be able to bring it down to 2 cases per 100 with the product with it, right? But without
Hmm.
the foot bathing, you're not going to see the effect.
Right. Right. Absolutely. And on the topic of foot bathing, I I'm really glad you showed those pictures of the different types of setups and the dimensions. Because one of the things that I had a producer just recently talk to me about is, they have a little bit of a wonky setup to run their cows through, and they're like, the cows are just stepping on the outside of it. We're not getting the contact that we like, all of that. And so I said, all right, I'll come over, come look at it, just watch what you guys are doing. And we talked about it and discussed of just, what's possible that we can do within this space, because it is very limited space and they don't have options for permanent setup in that area. And so I said, if you're able to set something up in the meantime of closing it off a little bit to have more of a straight lane setup where they can't walk around it, you have the desired length,
Yep.
and to get that amount of contact, at least 2 footfalls in for each, go for that golden ticket in there. And just getting an outside perspective in there was a game changer for them. With that, for like mixing with powder and getting those concentrations right, what do you recommend? As like, is there a calculation? Is there a rule of thumb that you use? Because I've seen people just dump a bag and call it a day and run all the cows through, and I'm like, okay, by your second group it looks brown instead of blue or whatever. So
Yes.
yeah, what are your thoughts on that?
Great question. So foot bathing, like more is not always better, but
Hmm.
when it comes to like frequency or but even the product, right? So I think we need to do some math, figure, okay, what's the volume we're dealing with? And then typically, depending on the product, so if you're using copper sulfate, um, and depends on if you're using the acidifier. If you're using acidifier, you want to probably have a 2.5% solution, but a pH that starts off around 3. There's some chemistry that happens if the pH is above 4.5, then the product isn't as effective. And to
Okay.
get it basically 100% of the copper in solution, you need it to be around 3. But you don't want to go below 3, because if we get it below 3 with pH, then the lesions become more aggressive because it's too acidic.
Okay.
So that's for copper. With formalin, you can probably get away between 1 to 3% solution. We don't need to go all the way up to 5, because kind of the same thing kind of holds true that if we get too aggressive, basically, if you think about it, if we get too aggressive, um, it's kind of like calluses. If we get too aggressive with our hands, they start to grow calluses. Well, the response for the cow, the equivalent for the warts, is kind of those hairy tentacles that you
Yep.
see. They're not necessarily hair, but they are like they're basically skin cells. The body's saying, "Hey, I'm injured. I need to grow. I'm so
Right.
injured. I grow more horn." That kind of
It's the body trying to protect itself, and you're
yes, those hairs that we're seeing that we call the warts, they're actually something called dermal pegs. So they're cells
okay.
that they can't know what they are anymore. So they just grow wildly loose, because normally those dermal pegs are surrounded by skin cells. So you kind of have dermal pegs all through your through the skin, and
Okay.
they go kind of wild and they grow up because like I don't know what I'm supposed to be, so I'm just growing
But I'm
up.
here.
But I'm here, right? Um,
Yeah.
so there's supposed to be a lot of skin around those hairs, and because we're
Mm,
not seeing that skin around it, like basically dead keratin around it, they kind of look like hairs.
interesting. Oh, that's absolutely
But yeah,
fascinating.
that's because you've
Awesome.
basically eaten away this bacteria, have eaten away those layers of keratin,
Right.
basically
Right.
exposed basically the dermal layer.
Ah,
Um, and then they says, well, I don't know what I'm supposed to be anymore. There's so much damage that they didn't go into
right.
overdriving. And
Ah.
sometimes you'll see hyperkeratosis, which is kind of the raised thick edges
Hmm.
that have more skin. that's actually present. So
Right.
but if it's smooth instead of like the hairy, like that's a
That's a different thing.
different thing, but related thing type thing.
Okay.
Yeah,
Gotcha.
back to your concentrations. Basically, if you're around 3% on both products, you're probably fine. But the biggest
Okay.
thing to think about then is how can we do it safely, right? So
Right.
how can we do it without people handling the product or disposing of the product, right? So
Mm-hmm.
copper sulfate has a risk of accumulation in the soil.
Mm-hmm.
Formalin has a human safety risk.
Mm-hmm.
But I would argue we manage risks in our life all the time. So if we can handle the formalin without the human health hazard of like if we can get it into the foot bath without people touching it
Right.
or wearing facial protection or
Right.
safety procedures like goggles or whatever it may be, then the risk is fine, I would argue, because to be honest, we're breathing formalin in the air right now,
Mm-hmm.
right? So it's a normal part of thing, and there's a safe level. And when we've looked at for the safe levels, as long as the space is well ventilated, like the biggest levels we find is if we have it in a milk room and you pump it into a pail and carry the pail. The highest levels are in that milk room because it's an enclosed space,
Right.
that type of thing, right? So if we can
Right.
get rid of that part of the process with a pump or those
Mm-hmm.
type of things, then we're doing things to manage risk, right? And no foot bath chemical, you want to fall into the foot bath, right? So it doesn't matter if it's an organic type product, like an organic
Right.
acid, it's still an acid. Like there's a product with teacher oil in it, right? I don't want to fall into a foot bath of
It
teacher oil and get that in
hurts.
my eyes. It stings and it's
Yeah.
nasty smell, right? So I
Yeah.
don't want that in anybody's eyes or anything like that. So there's still a hazardous chemical, right? Some of the other
Right.
ones are cautionary ammoniums. They all have big X's on it, right? So they're chemicals and we have to treat them like chemicals. We have to manage the
Mm-hmm.
risk.
Well, I don't have any questions come in. So, with that, I'd like to thank everyone for joining us today for our webinar session. And thank you so much, Dr. Kramer, for coming in and sharing your knowledge and expertise on all things heifer hoof health management. I learned a lot personally, and it was great just having open discussion and learning from all the things that you've seen and the work that your students have done out of your lab. I want to encourage everyone, if you have time, to please do our post-session survey. Feel free to contact I or Dr. Kramer with any follow-up questions that you have. Once again, thank you all so much for joining us and have a great rest of your day.
Thanks for having me.